County Kildare, where restrictions have been imposed. There was also one further death reported. Well, the country's acting Chief Medical Officer, Dr. Ronan Glynn, is here in studio. Thanks for coming into us this evening. This is a fourfold increase on the number of cases reported last Saturday. What's happened?
So in one respect, it's not surprising, and we have been expecting an increase in cases today, and we're likely to see significant numbers of cases over the coming days as well. That's as a result of all of the testing that's happening, that hundreds and hundreds of employees and close contacts have been tested across these three counties over the past number of days. So it's not unexpected, given what we know about this disease and how easily that it transmits, that we're seeing a significant number of cases coming through tonight. But the one optimistic note, I suppose, is that, again, the vast majority of these cases to date are linked directly with the clusters or close contacts of people who are working in these facilities. So we're still as confident as we can be that the disease has not leaked out more widely into the communities in these counties. And that's why we were so keen to move yesterday when we did, because if it gets out there, it will be so much more difficult to control.
And just on that, you know, some people didn't know for up to a week that there was a cluster in a meat factory. They were technically in an at-risk area. Should people be told much more quickly if there's a cluster near them, which isn't in a family home, for example?
So clearly, we've been monitoring the situation very closely in these counties for the past 10 days. And there's always a balance between information, panic, and giving the appropriate information. And that's why I came out on Thursday night. Thursday night was when we really became aware that there was a situation over and above what would be expected. So we will always expect to see clusters and cases, and there are a range of clusters going on around the country as we speak, many of which are linked to extended family outbreaks. But as soon as we became aware on Thursday night that there was a significant issue, we had the press conference. We warned people, particularly those in vulnerable groups and those who are aged over 70. And I want to reiterate that advice again tonight for people across those counties, just to take that extra bit of care, be really cautious over the next couple of weeks until we get this under control.
Is there an obligation on those factories, though, to inform the Department of Health as quickly as possible? Are they doing that?
So when there's cases like this, the public health teams go in. As soon as there's more than one case, the public health team will go in. It'll be defined as a cluster or an outbreak, and all of the necessary measures that need to be taken will be taken. One of the reasons we're seeing so many cases now, compared to what might have happened a number of months ago, is that we're aware now that many people can be asymptomatic. So we don't wait any longer for people to have symptoms. We now go in, we test everybody, and that's what's happened over the past few days. If I might, there is another message, though, that needs to get out tonight, and it's not to the people in these three counties, it's to the country as a whole. So we have about 50 cases tonight from other counties. 2 weeks ago, if we were sitting here with 50 cases, the country as a whole would have been worried. We can't lose sight of what's happening elsewhere. And I really want to send a message out again to please, for everyone, be cautious over the coming weeks. We've seen what's happening internationally, and we have a particular problem in a region, but it doesn't take much for that to spread. It won't take much for other regions to have a problem as well. So we need everyone to take all of the measures that we've been advocating.
So were some of those other counties potentially looking at restrictions as well? Dublin tonight has 27 new cases.
Not at this point. So one of the key measures that we look at is the 14-day incidence, and the national 14-day incidence at the moment is 16 per 100,000. Just for comparison, Kildare is at 130 per 100,000 tonight. Offaly is at 80 per 100,000. Laois is at 60 or 70 per 100,000. Dublin, in comparison, is at about 10 or 11 per 100,000. So the absolute number of cases in Dublin will be higher than other counties because a significant portion of the population lives there. So no, we're not contemplating that for anywhere else at the moment, and we certainly don't want to get there anywhere else. We didn't want to have to do this in this region, and hopefully we will be out of it in 2 weeks' time. But again, it comes back to each and every one of us following the advice and doubling down over the next couple of weeks to get this under control. OK,
Dr. Ronan Glynn, thanks indeed for that. Now, in other news, 2 men have appeared in court charged in connection with the seizure of up to €3 million worth of heroin in Dublin. 31-year-old Keith Quinn, with an address at Monastery Gate Avenue in Clondalkin in Dublin, and 41-year-old Andrew Noonan of Red Hills Park, Ellistown in County Kildare, were charged with possession of illegal drugs and possession with intent to supply. They were remanded in custody.